All right. Welcome to All Things Odd. I am Dr. Natalie Phillips.
And I'm Dr. Hannah Galloway.
And we are going to start off with kind of talking a little bit about our YouTube channel. So now that we're starting all over again, we want to make sure that we can get people subscribed to our YouTube channel. It's also important because if you don't have access to Facebook, you can always come and watch our live videos here, or they sit here, after we record it. And so, just type in Audiology Center of Northern Colorado. We have 6 subscribers, so we're going to watch go up, and then hit that subscribe button. So what's cool about this, I love this about YouTube, is that if we go over to videos, it'll kind of show you basically uh, a little bit more about, all of our videos out here. Let me see if I can kind of get that going here, moving. Sorry.
I feel like it's easier to tell what they're about on YouTube. Like it just kind of gives you the topic, and I feel like the little thumbnail image is kind of more obvious.
Yeah, so you can see all the different ones we have. And then they're also organized by playlist. This is what's kind of cool. And so if you want to go back to what we talked about in technology or Better Speech and Hearing Month, hearing protection, as we scroll down here, you can kind of see, some of the research spotlights, some of them are in multiple ones, right? With the bone anchored hearing aids, the cochlear implants, because we talked about how you can do that with the Redux system, just about our practice. So there's 15 so far. We're knocking them out, trying to get these shows and these videos done. All together, All Things Odd, we have 15 episodes, and so you can kind of go to this one and just play all of them if you want to. So yeah, we wanted to definitely show our YouTube channel to remind people to subscribe there, but then also to make sure that that you can always catch some of the things that we do over there if you missed it. So today we're going to have a little bit of fun, and we are going to actually talk a little bit more about water in your ears, because we thought, since the summer months are coming up, we're going to cover water in your ears. And the first thing we're going to talk about, we're going to try to work from the outside and move inward, is we're going to talk a little bit about the outer ear. Okay, so we're going to actually talk first about exostoses and osteomas. So I love talking about this topic because growing up in Hawaii, it was different because as an audiologist there, I don't think I've ever seen exostoses. And basically what exostoses are is that they're like these bony growths that kind of come in the outer ear canal, and they push the skin forward. So what I'm going to try to do is I'm going to try to share a screen while I'm talking. But with these bony growths, they can, they can trap water in there, wax in there. You can have ear infections because it stays in there too long. And so I'm going to put something up that is actually it's not a bad picture. It's just something that it's a cartoon first. So we'll do kind of a drawing cartoon so that you kind of know what we're talking about. So this is what exostoses and osteomas kind of look like. And when I learned a little bit more about these, it's because I worked in California, and with the colder water, these types of patients started to come in, and I would look in the ear canal and I'd be like, what is that? And I soon learned that with cold water, it's a little more prevalent. So in Colorado, there's a lot of people that spend time on the river. Even in the summer months, the water is really, really cold, right? Or we've got reservoirs or whatever. California surfers, this is what they call surfer's ear, right? And so, I saw a lot of these types of exostoses where the bony growths actually occur on the bone. So they're hard, they're not soft, and they push the skin in the ear canal out. And so, that's where I've really learned more about exostoses. Now, what's interesting is that I did a study with the neurologist that I used to work with in California, and we were trying to measure, number one, we were looking at the efficacy of his surgery, right? And the surgery basically is an outpatient surgery under anesthesia. They lift up the skin, they shave down that bone, and then they put the skin back on. And so we were looking at the efficacy by measuring ear canal volume. And so we would take a measurement using our admittance bridge and take an ear canal volume before and after. Well, we decided to also kind of track and see, hey, what kind of, do they have hearing loss from this? Because you can see that there are kind of holes that would transmit the sound through, right? But we were trying to find out if there was a hearing loss associated with these types of patients. And initially, I thought maybe a low frequency hearing loss because it was taking up space. Like if you have an earplug and you kind of halfway put an earplug in, you don't hear as well. And what we found out in our research, just by doing some testing, is that these patients that had exostoses actually had a high frequency hearing loss, which I thought was kind of interesting. And I know that Dr. Galloway and I talked about this and had some different ideas of why it would be a high frequency hearing loss, but that's what we kind of saw. Yeah. So I'm going to take this off here. Anything to add? Well, I'm going to put one more.
Well, no, but I was just thinking that with those in the ear, it would kind of keep the low frequencies from leaking out, right? So I guess that makes sense when I actually think about it. But I'll also say, and of course, in that drawing, it's only 2-dimensional. But when you look in the ear, they're not all like around the same, they're not all the same depth within the ear. So, and when we look in the ear, of course, we're still getting, 2D too, but you can tell that some of them are behind the other ones and some of them are in front of. So the picture, I have seen ones that look like that, where there's just like a little space in between, but the picture was kind of I don't know, these pictures are easier to see how they're not all sort of at the same depth within the ear.
Right.
Which even if you're trying to get a hearing aid in there, you might be kind of like snaking it through, all these little growths. So I have seen a patient that it was really hard to wear a hearing aid because it had gotten so bad. And I think he was looking into getting surgery for it, but.
Yeah. And I mean, like we said, these are hard, right? These are bony growths. So they're not soft, cushiony. Okay. So I didn't warn you guys before I put this picture up. We had a cartoon drawing of exostoses before, but there's 3 pictures here. So the first one obviously is looking into the ear canal, seeing that healthy eardrum, right? Seeing that that cone of light, seeing, the middle ear bones, that you can kind of see through, and it's pretty opaque, right? The second one is exostoses, but it's not as bad, right? You can see what Dr. Galloway was talking about with the depth. Some of them are closer, some of them are further, it's hard to really tell. And it looks like we can still see part of the eardrum right in the middle section, right? And then that third picture all the way to the right, man, that's pretty bad, right? And
yeah.
When do you do something about this, right? And if you can look at that third picture, imagine like jumping into a pool or a lake or even a shower, and then getting that water trapped in there, and it's like you don't have it's harder for you to get out of there. And so as the water sits in there, it can kind of fester and get infected, and you'll start to have outer ear infections. And so the question is, if you're noticing that maybe there is like more pain, right? Like Dr. Galloway said, maybe you're kind of trying to use things to get the water out, or that hearing aid is kind of right up against that bony growth, right? That can cause some pain. So when do you do something? And again, I had spoke about the outpatient surgery before, but really it is starting to be where it gets to be like picture number 3, maybe even the middle picture as well, when it's harder for it to drain and you're starting to lead to other things that could happen because of the exostoses, right? Prevention wise, honestly, it's if you're starting to have this and you live in an environment that has some cold water, and you like to swim or you like to be active like that, then I would probably recommend try to wear swim plugs or earplugs as much as you can when you go in this cold water environment, right? Surfing, it's a little bit harder because you do have to kind of, it depends. I guess if you surf with people, then you would have to kind of want to hear them. But at the same time, again, if you're kind of by yourself, then you might not necessarily need this, need to communicate, and you could use the swim plugs. But if you can, if you're just going river rafting or spending time in that river that has cold water, try to really protect your ears so that the cold water doesn't get in there and sit and create these bony growths over time. So that's something that we're seeing, why there's this, how do I get water in my ears and how do I get it out, what to do with something, if there's any prevention. So we see exostoses and osteomas. All right. The next question that I wanted to pose also is, what is the best way to dry out my ears? We get that question a lot. And, we laugh because I know that Dr. Galloway and I had talked about, well, you turn your head to the side and you hop on one foot, and you just try to get that seal to break, right? Where you can kind of get that water out. There are other options that people have talked about, such as like use a blow dryer, right? Which I'm not really too sure how that would necessarily work. You'd probably stand there for a long time. People have used Q-tips, which again we've had an episode of what you put in your ears, and Q-tips do not, even though they have that cotton swabs, I should say, have that little piece at the end. There's not enough to absorb that water out. And I think that we had talked about, Kleenex, right? Rolling up that Kleenex, kind of
Yeah.
sticking it in your ear after a shower to get that water to absorb onto that Kleenex. And it's soft. And so it won't actually hurt your ears, possibly cause damage or push wax in further, right? Whereas a cotton swab or a Q-tip could. So I'm not too sure necessarily about some of those things. There are also over-the-counter eardrops that you can kind of put in. Sometimes they are a mixture of different things, like or a homemade mixture you can do of vinegar and alcohol. And if you've kind of seen, if you like go into your sink and you take rubbing alcohol and you kind of drop it into your sink that has some water, you'll see the water dissipate. And it's because alcohol almost like repels that water, right? And dries it out, I should say. That's what it does. And so you can do a little bit of vinegar mixture and use a dropper or a bulb to drop it in there, and it might help really try to get that water out, or help it evaporate. The other thing I wanted to show you guys as well, so I'll try to get that one up as well. Here is, let me see, share screen. It was kind of a cool thing that we found. So this one is it's after swim. So these were things that they're very thin, almost like sponge-like material.
It's like a dried out squeegee, kind of. That's what it looks like.
Or I'm thinking of like those animals, those like little animals that come in capsules, and then you dump it in water, and then all of a sudden, after a while, the capsule like disintegrates, and then all of a sudden you've got this sponge animal. It's kind of like that. So you would hold the tip to your ear and then allow, the water to absorb on it. And then you can see in that third picture that it gets more sponge-like, right? And it's porous. And so it comes out super flat. It's something that you can maybe stick in your swim bag or something like that. And then you can use it like the second picture, and then really get that water to absorb on there. But that's called after swim. So check with your hearing healthcare professional or an audiologist to see if they can carry some of those that you can purchase from them. But they're after swims, and we thought this was kind of really cool to have, to help dry out the ears as well. Yeah.
Well, and I think it's kind of counterintuitive that, okay, you're worried about water in your ear, yet you're going to put drops in there. But the important part to remember is that like alcohol or even peroxide, you can do 50-50 peroxide and water. Those are going to dry out the ear. So it's going to try to dry out what's stuck in there. So I know it does kind of seem counterintuitive, but it's really just that it's trying to dry out the area.
Yeah. Oh, and let's talk about this too. I know that you had received a lot of questions, even with your daughter, who's now a little bit older. But I remember you talking about how people that took care of her were giving her baths, and having the question of if it's okay for water to get into your ears.
Yep.
Right.
Yeah. So I think when we look at the actual ear anatomy, people get confused because the inner ear is filled with fluid, and it's supposed to be, but we can't get to the inner ear just like by sticking our finger in our ear. So, and we're going to have a little graphic here in a little bit, a little animated video that we'll show, but it shows the different parts of the ear. And in a healthy, normal individual, the ear canal, ends at the eardrum, and the eardrum completely seals off the ear. So if you put your head underwater, the furthest that's going to go is to your eardrum. Which is about, I think, 22 millimeters is the length of the ear canal, something like there, around there. So it is a little bit in there, but it's sealed off. So a lot of times people will say, well, I can hear sloshing around in there. Well, unless you have a hole in your eardrum, it didn't get past your eardrum, but it can kind of get stuck in the little S-shaped bend that you have in your ear. And so that's where we're trying to get the moisture out of. So yes, it's totally fine to put your head underwater, get all the water in your ears. I remember as a kid, I would get water in my ear after the pool more often because I was trying to do like somersaults and headstands, like all kinds of stuff underwater. Now that never happens to me, but I'm also not really doing those things. So I think that's why kids have more of an issue with it. You may have heard if a kid has tubes in their ears, they're not allowed to get their head underwater. That's because they have a hole in their eardrum. So it was a man-made hole in their eardrum. But if the liquid gets past that, then you can get in the middle ear cavity, and it can be really uncomfortable. So as long as your eardrum is intact, it's totally safe to get water in your ear, and it will just dry out. But if you have a tube or a perforation, it's kind of a different issue, and you might need a plug or something to kind of seal the ear canal off.
Yeah. All right. So, which kind of leads us to the next question that we had, which is, why do I have difficulty with pressure in my ears while in the water? And so before Dr. Galloway kind of goes through that, I wanted to play this video here to show you how the ear works. And we'll see. Yeah, it works.
Okay, I'll narrate since we don't have sound. But essentially what it's showing you here is the anatomy. So that eustachian tube that it just pointed to, this little pink tube down there at the bottom, that's what equalizes pressure between the inside of your head and the outside of your head. So this little membrane here is the eardrum. And I watched this video earlier. It's going to show pressure on the outside of the eardrum versus the inside of the eardrum, or the inside of your head. So when you go up in an airplane and you feel the pressure build, and then you swallow, and then all of a sudden the pressure releases, that's when you're getting, more pressure on the outside than the inside. And once you swallow, your eustachian tube opens and closes and corrects it. So the whole job of that tube is to keep the eardrum not concave and not convex, but just sort of, midline. And so when kids have issues with that, when that eustachian tube's not working appropriately, fluid gets backed up in there, and that's when we end up putting tubes in the ears, things like that, when it's recurrent. But for most adults, this is what should happen. And so you can imagine that if you're diving down under the water, like let's say scuba diving, the pressure on the outside of your head is going to be much greater than what's inside of your head. And so people, take classes on how to scuba dive properly and how to clear their ears properly. I know the speed of the descent has a big part of it, because the faster you go down, the more aggressive the pressure is going to be. So you have to kind of limit the amount of pressure. I have also seen, so when the ear gets injured from a pressure mismatch, we call it barotrauma. And so I've heard of, routinely barotrauma from scuba diving. But then I also looked it up this one time in grad school because I had to present on it. And there are actually people who have had barotrauma from like elevators and roller coasters, just because of the pressure change so quickly. If you're at in a skyscraper in New York City and you descend on an elevator and go all the way from the top all the way to the bottom, and it goes super fast, that's something that can happen. Not very likely, but there are case studies of that kind of thing.
So I was hearing the narration because I have my AirPods on.
Oh.
So I was sitting here going, oh yeah, this is really interesting. And you're like, oh, let's narrate because I can't hear it. It's because it was in my AirPods. So, but you did a great job. I was listening to both of you, but I did put the link to that Vimeo it's from the St. Louis Children's Hospital. And so I put it in the comments so that way people can watch and actually hear the narration, because it's exactly what Dr. Galloway said, but still, it's really kind of cool. I like that video. So yeah, I just wanted to let you know, like, oh, I was hearing it right here.
Well, and I think it makes a lot of sense once you understand how it works. Like, why do I feel that pressure sensation when I'm climbing altitude in the mountains or going up on the airplane? Like, yeah, there's pressure building either, in front of or behind that eardrum. And so it gives you that sort of discomfort.
Yeah. Yeah. And then what about like diving and barotrauma too? So we talked about pressure in the air, right? And I love that video because I love how it actually shows the pressure equalization. But what about like diving?
So water pressure is going to be the same as air pressure. So there are, techniques, and usually people get kind of certified when they go scuba diving, and they'll teach you, how to descend at an appropriate speed and everything. So you're not going to put yourself at risk. But in general, I would say pilots or people that scuba dive a lot, we do a test called tympanometry, which is putting air pressure into the ear and then taking it back out to see if your eardrum will move in response to the pressure. And what I've noticed just personally is that people who are pilots or scuba divers, they have a more compliant eardrum. Like their eardrum moves more. And I'm guessing it's just because they have, sort of done that repetitively over the course of their lifetime. I mean, think about how many times a pilot has ascended and descended versus just, a regular passenger. So that's interesting.
Yeah, yeah. Well, and I think it's interesting too to let you guys know that, just because a patient comes in to us and they say that they've got fullness in their ears, we have to try to decipher and figure out where that fullness is, right? Like
Mhm.
we talked about some different things as far as outer ear, middle ear, and even we did talk about the inner ear, really. But so it could be something in the outer ear, like wax, right? That would cause
Mhm.
fullness. It could be eustachian tube dysfunction, which is what the video showed and what Dr. Galloway was talking about, right? It
Mhm.
could be that they have middle ear fluid, which is like an ear infection, or not
Mhm.
all middle ear fluid is an ear infection. It's just, it could be middle ear, what we call effusion or fluid in the
Mhm.
middle ear, right? But it doesn't necessarily have to be infected. So we've got the middle ear, and then you've got the inner ear as well that can cause pressure and fullness, which would be hydrops, and that would be the
Mhm.
inner ear. So you've got to figure out, or we've got to figure out, for those of you coming in, when we have the history point of, yes, I have pressure and fullness in my ears, we're going to prompt and ask, what happens? Do you have sinus issues? Do you have
Mhm.
allergies? So we know what kinds of tests to do to figure out if it's outer, middle, or inner ear, right? So it's
Mhm.
really kind of interesting. I know that we had really talked about just water in the ears initially, because we're heading into the summer months and there's going to be a lot of people hopefully getting out, into some different environments and different places where we can actually have opportunities to either use earplugs or, to really educate about trying to get that water out of the outer ear.
Mhm.
But, again, when we talk about fullness, we just wanted to touch upon that there could be fullness at any range, right? It could be the outer ear, it could be
Mhm.
the middle ear, it could be the inner ear, it could be fluid, it could be the way that the ear is actually working with the valve that you saw. It's kind of looks like a valve, right? That
Yeah.
eustachian tube. So with that, send us your questions. We put that video up in the comments as well. And hopefully, this helps explain a couple of different ways of how you can manage water in your ears, or if it's time to see a hearing healthcare professional and an audiologist to make sure that we can kind of really diagnose what's going on in your
Mhm.
ears. All right. So with that, we're going to head on out for today, but we will be back next uh, Thursday, 12:30 p.m. Mountain Standard Time with a whole new episode of All Things Odd. So thanks so much for joining, and we will see you then. All
Thank
right.
you. Bye.
Bye.